Sincerely, to me, hospice is the best thing that happened to us.
The foundation was there when we needed them.
Community Hospices of America Foundation assists hospice patients and their families during the difficulties of terminal illness by making financial grants for services and products not covered by Medicare, Medicaid, or private insurance.
The Community Hospices of America Foundation is an organization that brings together the patients, the families, the staff, and the volunteers to make a coordinated team that extend and make patient care better. What we need to do now is to help you and others understand what hospice is and how it works and how the donors work and how to get the dollars out there back to families to help them have better care.
Grant guidelines are in our Policies and Procedures Manual on our website, chafoundation.net. A hospice agency may apply to the foundation to become a member agency. After the Foundation Board approves the application, a member agency may apply to the Foundation for grants. We make grants in the following categories. Patient care. We help patients and their families pay for utility bills, medications, mortgage payments, electric heaters, wheelchair ramps, personal grooming items, home fumigation, and many other necessary items and services.
Community Hospices of America Foundation helped us with our utility bill and lifeline, and I do not know what I would have done without it because I could not have paid the bill, needed the lifeline, and it was immediate. When I asked for it, within 10 days or less, I had it.
Our family support services include helping patients and their families pay for temporary caregivers, travel expenses for family reunions, auto repairs, utilities, and mortgage payments.
Community Hospices of America Foundation provided a grant for music therapy services for my granny. It improved her quality of life and it improved our time left with her.
When it comes to community education, we help fund health fairs to recruit hospice volunteers and host workshops to inform healthcare professionals, volunteers, and the public.
There are several myths about hospice, and one of our challenges is to really dispel those. One of them is that hospice isn't allowed until those final days, and that's not true. The average length of stay for hospice patients is short, but our goal is to be there for months ahead, and we're really looking at those last 6 months of someone's life to be able to really maximize their quality.
With our Volunteer Enhancement Program, we help fund dinners and luncheons for volunteers, foster attendance of volunteers at workshops, seminars, conferences, and help purchase educational materials.
I could not have found a better organization, more wonderful people, or anything. They were absolutely wonderful.
With the foundation, we have funds available immediately to work on our dreams. And in the hospice world, time is everything, so it's very, very important that we have these funds available.
The donations come from a grateful people who are giving thanks with donations for the good work given to extend the care of people they loved in the family protection. But this helps us that we can then send thank you letters, which is required by law, to the donors that have given to the hospice patients. And when they read the letter, they will have the feeling, I'm glad I donated that.
Donors usually contribute by check. An agency staff member will sign checks for deposit or stamp them with a Foundation Bank deposit stamp. The Foundation provides the stamp and Excel spreadsheet form. The agency staff member prepares a bank deposit slip and mails the original slip and checks to the Foundation Bank. The bank's name and address are on the deposit slip.
Each member agency will receive a financial report to the executive director and social workers. This report contains the total contribution balance and the grant funding that is used for that agency.
Families and friends of a hospice patient will contribute when they understand how their gifts benefit. When every agency staff member helps get out the message that contributions help patients live more comfortably, access quality care, strengthen involvement with their families, and keep their dignity, it helps caregivers, health professionals, and the public better understand the role of hospice.
The Foundation provides brochures and remittance envelopes for office staff to distribute through funerals, welcome packets, families and friends, memorial service, and any other places to reach those who care.
Guidelines for funding grant requests are in Section 300 of our Policies and Procedures Manual, available on our website, chafoundation.net. A member agency makes a grant request by email from our website by selecting Apply for a Grant, filling out the form online, and selecting Submit. The request goes to the Foundation Secretary, who codes it and forwards it by email to board members. Board members usually respond within 1 week to accept or decline the request. The Secretary then notifies the agency. For all approved grants, the agency must provide a copy of a statement, invoice, or receipt for payment to be made. These may be faxed or copied and emailed to the Foundation Secretary. The Secretary will mail a check to the agency or vendor for approved grants.
People need to know that there is an organization that helps people who are dying to have an easy and pleasant experience in their life. And when hospice comes in, they just say, "Oh, I'm so pleased. I couldn't have got along without them." And this is the reason we keep doing it.
For more information or to schedule a free training visit to your agency, contact Foundation Secretary Rachel Snyder or Foundation President Dorsey Level. You also may use the contact form on our website.